Hi everybody, I'm Dr. Joseph Cipriano over here at Palmetto Physical Medicine in Greenville, South Carolina. Today we have our patient here. Now I know that you've been experiencing some low back pains, correct?
Yep.
Okay. So where are you feeling it? Is it just in the middle of the back, to the right or the left?
It's mostly right down at the lowest part of my back, and it's from sitting all day. It's worse as I sit.
Worse as you sit?
Yep.
Okay, that's when you notice it the most.
Mm-hmm.
Does the pain stay in the low back, or do you ever notice it go down into any of the legs?
It just stays right here.
Stays in the low
Yep.
back. All right, and then I'm guessing over time it just increases and...
It does. If I lay down, it's better, but the car ride home after sitting all day is terrible.
Okay.
Yep.
Okay, so what we're going to do today, we're going to go through and do the adjustments on the low back. So we're going to check the sacrum, we're going to check the lumbar vertebra, and then we're also going to check the hips and pelvis, okay?
Okay.
Perfect. So then today also, I'm going to show you guys a little bit something different. We do have a new feature, new feature to YouTube, but it's always been at the office here. So I'm going to show you that, guys, at the end, so it'll be kind of something cool just to stay and pay attention to. All right, so what I'm going to have you do, I'm going to have you lay face down for me. Okay, so what we're going to do here, I always start off by scanning the spine. I'm going to be palpating the spine. I know it's really the low back is what we're dealing with today. So I'm just going to palpate. Palpating is just me pushing in, and I'm really trying to feel for the tonicity of her lumbar spine, and I'm trying to feel for any tight muscles, any kind of differences between the left side compared to the right side. So even actually just with pushing in, I can tell her right side is raised up higher than the left. Is any of this painful when I push in?
No, feels good.
Feels good, okay. Any pain directly over the lower part, because that's where you're saying?
Nope.
No, so it's because you're laying down, you're not really feeling any pain then?
It's good when I lay down.
Okay, so it's good when she lays down, but when she does sit, and I know a lot of people, they do have a desk type job where you're sitting all day, and I know there's probably a lot of people that can relate to her and this pain that she's having. So, as she's sitting, she gets increased pain. Now that pain you said was right through here? Both sides, so a little bit on the right, a little bit on the left. So this is, the areas that she's feeling with that prolonged sitting. So things that I'll look at, I'll come down here. We're going to check the leg length. So as you can tell with the leg length here, this right leg is quite a bit shorter than the left. Then what I always do, I'll always scan up a patient's body. I'm looking for any of those imbalances. And she's a little bit like this. That right side is raised up a little bit. So these are things that I'm just looking at. Now what I'm going to do is I want to do a test, and I want to see if we're having any sacrum involvement here. So what I'm going to do, I'm going to put pressure down on the sacrum, and I want you to raise, starting off this leg, as high as you can for me. Any pain, tenderness, tightness with that? No. Okay, relax. And raise this leg up as high as you can for me. Any pain, tenderness, tightness?
No.
Did you notice that this left leg goes up quite a bit higher than the right?
I didn't.
You didn't? Videographer over here, did you see that?
It definitely does.
Okay, so her left leg, and I know everyone at home would be able to see this, her left leg went up quite a bit higher. So granted, the good thing, she's not feeling any pain with that, but what that's telling me is her sacrum is actually rotated more towards the left side. When the sacrum is rotated more towards the left, what's happening is the muscles and ligaments best way to put it, are looser, they're more lax, so it gives her the ability to raise that leg up higher. Now on the right side, what's happening is the ligaments and muscles, the fibers are taut. So when they're taut, it's restricting this leg from lifting up higher. But like I said, good thing she's not having pain, but we still want to fix the biomechanics of her sacrum to her hips. So what I'm going to have you do is I want you to cross your bad leg, which is your right leg, over your good leg. Okay, so we're going to raise the table up. We're going to make sure and adjust the setting here. Good. Okay, so now as everyone knows, so her sacrum right now is currently off to the left side. We want to do a counterclockwise torque with a P to A drop. P to A meaning posterior to anterior. So we're going to do the drop and we're going to torque. Good. Uncross. Perfect. So now from here, what I'm going to have you do, I'm going to have you bend this knee. And we're going to raise it up. Good. Okay. So now this time around, what I'm going to have you do, I want you to re-lift both legs. So we'll start with that right one again. Now do the left one. Wow. Now I know that everyone, especially watching at home, will really be able to see the difference. Now did you notice a difference?
Yeah, at that time I did. Now that I'm focused on it.
So that time she did notice a difference that she's focused on it. I just wanted everyone to hear it just because the mic's over here, so you may have not heard what she said. But yeah, just that little bit, that sacrum being rotated out of alignment. She wasn't feeling any pain, obviously, while laying down, but you noticeably could see the difference there. So what I want to do now, we're going to come back, we're going to recheck the leg length here. Better, but we're still a little bit short on that right side. So what I want to do is we're going to do side posture adjustment. So with that, now that we cleared out the sacrum, now I want to work on the lumbar vertebra. So I will have you turn and face me. I'm going to bring this up. Good. Okay. We're going to bend that top leg. I'm going to just bring you a little bit to your back. There we go. Come a little bit closer to me. Perfect.
That was a good one.
And I know you felt that quite a bit. And now we're going to have you flip to the other side. Okay. So a little bit tighter with this side, but let's go ahead and I want to recheck that leg length now. Let's bring this headpiece down so you can lay face down again. Good. Okay. So now, after getting the side posture adjustment, when we come in, take a look at how her legs look now. So I know that obviously you can't see or don't understand what's going on, but this time your legs have balanced, whereas before that right leg kept pulling short. So as you can tell, with doing the adjustment, we did the sacrum first and then we did the lumbar spine after with that side posture maneuver. So what I want to do with actually is going to be a little bit different today is I want to put you on a lumbar decompression table. So I'm going to have you stand up, and we're going to come right around over to this side. So as you can tell, this is our physical therapy side of the office. It's open because it's right now we're kind of on the lunch break, so it's nice and open. Normally during the day, this side also gets very busy. But what we're going to do today is going to be the lumbar decompression. So I'm going to have you lay. Your head is going to be up there. I want you to bring your feet through here. Good. Okay. So you can slide down just a little. Perfect. I'm going to bring this down too. So I have her feet hanging off the edge a little bit. What's going to happen is the harness here is going to wrap around. So where I'm feeling, I'm feeling for her ASIS. That stands for anterior superior iliac spine. So it's just a bony landmark on the front. And what I'm doing is I'm going to tighten the harness around so we can bring this down just a little bit. And it's going to be pretty tight. So she's rather a petite patient, so not really an issue there. From here, what we're going to do at the end, at the top here, I am going to tighten the table. So what's happening, as you can tell, is she's basically getting strapped into this decompression. Now, the reason that I really wanted to show this today was a lot of patients ask me about an inversion table. And when people bring up an inversion table, a lot of the times it's that old school inversion table that hooks in on the ankles and flips you upside down. Not bad, but let me show you guys this table and the reason on why this one is actually better than that old school one. So I'm gonna have you bend your knees. And you can relax. Okay, so then what we're gonna do here, now that she's all ready, she's all strapped in, nice and tight, we are going to lift the table on up. And as you can tell, the table is coming up quite a bit here, and it'll come up. So what's gonna be happening is, as the table comes up, we're now getting that lumbar decompression. You know, my cord's wrapping across your forehead. We're getting that lumbar decompression. So we bring her up just like this. Now, typically how we would start this off is in the beginning, I'm sorry, in the beginning, she would be on for a shorter amount of time, starting off 4 minutes and then gradually moving up to 7 and then 10. And then from there, so we'd keep her for 10 minutes in this position. Now, what are you noticing when you're like this?
I can feel like my lower back kind of pulling like this.
Kind of pulling apart? Okay, so the reason that this is very well is this is holding you in from the hips here, and now what's happening is obviously the force of gravity is pulling the rest of your body down while you're being held in from here. So a lot of times you get patients that, you know, that have asked me, you know, what are my thoughts and feelings of a that inversion table. This is the type of inversion table that people should be on, just because this is actually holding you in from the hips and not holding you in at the ankles. Because the ones that hold you in from the ankles, you're gonna feel a lot of pulling, you know, at your joints, in your knees, you know, in the femur, you know, in these joints. So you're not gonna get as much of a feeling or a pulling in that low back spine. So this is a great thing. And then another feature that we have, I didn't know we had that. She didn't even know we had that. Okay. So this is, it's just a, like a little vibration, and what that's gonna do, it's just gonna help her relax. The whole point with this, you know, we want her body to relax and just let everything kind of fall and just relax. So what we're gonna have you do at times, what I have patients do, is hang your hands over your head. So even with that, you can tell, right? When you did that, I could see how that kind of went up even more. It lets her come down just a little bit, but she's not gonna fall out of this table because, as you can tell, the straps here are holding her in, and it's right above the hips, that anterior superior iliac spine. So she's not gonna go anywhere. So then would have her on the table for, you know, depending on, you know, how many visits she's done, but up to 10 minutes. And from there, that would be the end of a decompression with the low back technique. And how was that feeling?
Good.
Okay, so I'm gonna let you stay on this for a little bit longer here.
Okay.
We'll just finish on up, but I'm Dr. Joseph Cipriano here over at Palmetto Physical Medicine out in Greenville, South Carolina. You know, if anyone is experiencing, you know, low back pains, you know, there are a ton of people that have that desk job, and, you know, you get pains, you know, as similar or probably can relate 100% to what you were feeling today. You know, feel free, you know, schedule an appointment. You can email, you can call. I'll have everything listed, you know, in the video here. And, you know, just would love to see you come on in. Have a good one, everybody.